So it looks like that this bill that was passed back down to the House is going to pass. So if the House and the Senate bill are the same, then this goes into law, which is going to be really bad for a lot of people. So I thought I'd go through the alternative names for Medicaid because I think that might be very important coming up soon. Also, I want to say that the Congressional Switchboard is 202-224-3120. Sorry, 3121. That's 202-224-3121. So that is what you would call to figure out, I think, where you would be routed to your congressional senator or person in the House, and let them know that you're going to primary them if they pass this, because this is going to affect everyone. Everyone. If you're not on Medicaid and you have a private plan like I do, this is going to affect you. If you live in a rural area where there's not that many hospitals to begin with, this is going to affect you because this is going to make hospitals close down across rural America in mass. It will close some urban hospitals, but mostly it's going to be rural. And it's going to be devastating because that means even if you have private insurance, you'll have nowhere to go to get care, or you're going to have to go greatly out of your way, maybe 100 miles away from your home to get care in some places, which is going to be devastating. It's going to be life-threatening and life-changing for a lot of people. Okay, so in Alabama, we're going to go alphabetically. I brought this up. This is the Medicaid by state alternative names, and this is on Medicaid's website. So, Alabama, they just call it Medicaid. Alaska, they call it Denali Care. So if you have Denali Care, you have Medicaid. And I think the reason why I want to go through these names real quick is because I think a lot of people, especially in red states, don't realize they're on Medicaid and don't realize they're about to be kicked off at some point, their Medicaid. And they're not going to have medical. And so these people are still going to go, they're still going to get sick. They're still going to go and need to seek care, but they're going to have to go to the emergency department, and that will raise uncompensated care greatly, and which will make that hospital or that system raise their prices on everyone. So that's going to suck. Anyway, so if you're in Arizona, it's called the Arizona Healthcare Cost Containment System. Could that be any more complicated? Or AHCCCS. Arkansas, it's healthcare, which, okay. California, it's called Medi-Cal. In Colorado, it's Health First Colorado. In Connecticut, it's called Husky Health, which I feel like that should be Washington because we're the home of the Huskies. Okay. Anyway, or called Husky C for age, blind, or disabled persons. Delaware, it's called the Diamond State Health Plan Plus, or plus like in brackets. Florida, it's statewide Medicaid Managed Care Program, SMMC, Managed Medical Assistance, MMA, Program Long-Term Care, LTC Program. And the long-term care, that's going to be hit significantly hard because a majority of long care facilities rely on Medicaid dollars. And if they're no longer going to get these Medicaid dollars, they're not going to be able to take care of these people. They're going to have to call those families, say, come pick up your person, and they're going to have to take care of that person full time because the people that are in these nursing homes need 24-hour care. And often there's only one person that will take care of them. I was put in that awful situation with my mother when she was dying of brain cancer. And they took her to hospice for like a bereavement for like a week, and then they kept her because she needed 24-hour care, and then they kept her in hospice until she died. Anyway, so in Georgia, there's no other name for it. In Hawaii, it's called MedQuest, which I really like that name. It sounds like a game, though. Idaho, there's no other name. Illinois, Medical Assistance Program, so if you're on that, you're on Medicaid. Indiana, Hoosier HealthWise, Hoosier Care Connect, MED, Works, Health Indiana Plan, HIP, Traditional Medicaid. In Iowa, it's called IA HealthLink. In Kansas, Can Care, Medical Assistance Program. Kentucky, it's just called Medicaid. In Louisiana, it's Bayou Health, Health Louisiana. Maine, Maine Care. Massachusetts, Mass Health. Michigan, Medical Assistance or MA, which is funny because that's also medical assistant. Minnesota, Medical Assistance MA, Minnesota Care. In Mississippi, it's Mississippi Coordinated Access Network, Mississippi CAN. Missouri, it's called MO HealthNet. In Montana, it's just called Medicaid. In Nebraska, it's Access Nebraska or Nebraska Medical Assistance Program, NMAP. In Nevada, it's just called Medicaid. New Hampshire, New H Medicaid or Medical Assistance. New Jersey, it's NJ Family Care. In New Mexico, it is Centennial Care, Medical Assistance. New York, Medicaid Managed Care. In North Carolina, it's called the Division of Health Benefits, DHB. In North Dakota, it's North Dakota Medicaid Expansion Program. Ohio, it's just called Medicaid. In Oklahoma, it's called Sooner Care. In Oregon, it's called Oregon Health Plan, OHP. In Pennsylvania, it's called Medical Assistance, MA, which is really confusing with multiple states have MA as the name of it. Whatever. Rhode Island, RI Medical Assistance Program. South Carolina is called Health Connections. So if you're in South Carolina, you're in Health Connections, you're on Medicaid. South Dakota, it's just called Medicaid. In Tennessee, it's called TennCare. Texas, Star Plus, which Texas has a fair amount of people on Medicaid. There's a bunch of people on Medicaid in Texas, and I think that's going to be a really big issue if this does pass, and I think it's going to, which is going to be devastating to a lot of people, and should be considered devastating to all of us, regardless if you think people are getting handouts or not. And I hate that this narrative that it's all these bunch of single men getting Medicaid. That's not what's happening. They wouldn't even qualify for Medicaid, to be honest. Anyway, so in Utah, it's just called Medicaid. In Vermont, it's called Green Mountain Care. Virginia, Cardinal Care. Washington, it's called Apple Health. I think it's because we grow a lot of apples in the state. I'm not sure. Washington, D.C. is called Healthy Families. And West Virginia, it's just called Medicaid. Wisconsin, Forward Health, Badger Care. And Wyoming, it's called Equity Care. So that's all the different alternative names to Medicaid, and there is money being stripped out of Medicare as well, which is going to be devastating to our older populations. So we really need to make sure that we are calling. If you live in a red state or a red district, I do not. My state's firmly blue, and my senators are all voting against this. So. And my people in the House, I think, are all voting against this as well. I don't think there's any Democrats that are voting for this at all. So if you live in a Republican-led state, if you have Republican House members, and you're on any of these programs, I urge you to call your congressman or congresswoman and let them know exactly what, why you need them to vote no, so you can keep your medical benefits. And so we also don't have this influx. And also, remember back to COVID. Remember when COVID was over, the hospitals were overrun by COVID, people that had COVID? And then people died of just regular things, like people got in car accidents and ended up dying because they couldn't get seen. Or people got discharged too early from a brain bleed and then went home and proceeded to die from their brain bleed because it wasn't stable. And had they stayed in the hospital like they would have normally, they would have caught it. They would have been able to save that person. And there's a lot of people that ended up dying as a result of not having access to care. And so that's going to happen again. If we force whatever hospitals are less to take on the burden of most of the people, especially these people that are going to have to use the ER as their only medical benefit, basically, it's going to overrun them. So if you have something that is not as dire as someone that's already there, you're going to be put on the back burner, and then your life might be in danger because we took a bunch of people off Medicaid so rich people can get more money. Like, we're literally stealing from the poor to give to the rich. It's a reverse Robin Hood, and it's very sick and twisted. And those Republicans that keep saying, oh, we're not giving anything, no tax breaks are going to the rich, they're lying. They're just straight up lying to you. They're lying to you because the Republican leadership has lied to Republican voters, and Republican voters sometimes parrot what they're being told. And it's a lie. And I think a lot of people on the right I think some of the people, not a lot, I think some of the people on the right are starting to wake up to what the Republican Party is actually doing, and they're actually harming their very constituents that voted them into office in the first place. So I urge you to call your congressperson and let them know that this is going to be a problem and that you're going to vote them out in the primaries. I think 2026 primaries are going to be lit. They're going to be swinging back wholeheartedly to the opposite direction. And honestly, these huge swings back and forth every 4 years or every couple years is really a problem. This is not going to solve anything for anybody. We are going to all be hurt by this, every single one of us. So we all should be standing up against this because this is not a good bill. This is an awful bill. And the tax cuts for the rich are permanent, but the tax cuts for the middle class, like myself, are not permanent. And even if they were permanent, I'd still be against this bill because it's cutting off so many people off Medicaid. And it's going to be a problem. So I urge you to call your congressman again, or woman. That phone number again, let me find it again on my other page. It is 202-224-3121. 202-224-3121. Please contact them today. Let them know you're going to primary them. You're not going to primary them, but you're going to vote them out. And that needs to have some power in this because they are scared. Republicans are scared in the House and in the Senate. They think they're going to lose their seat. And they probably will, especially if this goes through. So I really think this is a pivotal moment for us to engage with those people. Even if we have to leave them a message, send them a fax, send them an email, do all three. Do all three. Speak out in publicly in some way if you can. This is such a bad thing that we really need to, and it's not even looking out necessarily for one another. It's looking out for ourselves as well. We're cutting off our own noses despite our face because there are a selection of people in this country that don't want brown people in it and don't like poor people. That's weird. I think that's gross. So we really need to help stop this. Thank you for watching. Subscribe and hit that like button. Thank you so much for watching.